Good afternoon, everyone, and a very warm welcome to our virtual series and our discussion today on post-cancer surgical care, empowering oncology through nutrition. I'm Dr. Anoushka Amlani, and I'm honored to lead this discussion, and I'm eager to delve into the diverse aspects of surgical oncology with insights from Dr. Tushar Jadhav today. Hello, sir.
Hi.
Dr. Tushar is a senior consultant in surgical oncology, affiliated with many renowned hospitals and institutions all across Mumbai metropolitan region. He is one of the founders and directors of Mumbai Breast Care and Universal Onco Care. He has been practicing in Mumbai for more than a decade, and his main focus is head and neck cancer and onco reconstructive surgery. On behalf of Voice of Healthcare, I thank you for your presence today, sir.
Thank you. I'm honored to be here.
Thank you so much, sir. So moving on with our discussion today, my first question to you is, what are the most common complications that post-cancer surgery patients typically experience? And how do these complications vary depending on the type and location of the cancer surgery done?
Yeah, see, first of all the surgical oncology procedures are majoritarily having extensive resections, basically. So extensive resections and the extensive defect, and then we have to even reconstruct. Now, being focused on head, neck, and breast oncoplasty, we are doing extreme oncoplastic work. Now, because of this extensive resection, there is obviously the post-operative immune response, inflammatory response, and metabolic responses are aggravated. Now, one issue what happens in cancer patients, because this is kind of a chronic disease, and the patients are usually older people. So old age, long-standing disease, they have already a poor nutrition beforehand itself, that is before surgery. Now, besides many of the cases, we need to give chemotherapy before surgery. So that is neoadjuvant chemotherapy. And that chemotherapy goes as much as 3 months, 4 months to 6 months, and then we do surgeries. In such cases, again, chemotherapy hampers the nutrition. So overall, these patients are nutritionally very weak, nutritionally very poor. And if we see the amount of surgical resection they undergo, we need a good proper peri-operative nutrition to avoid complications. Now, complications in the sense, all these complications depends upon the site of the surgery, actually. But majority of these complications are avoidable by surgical skills and maintaining proper post-operative care.
Okay, sir. So, having discussed that, what about cases where you have to redo the surgeries and how do you plan them? And additionally, are there any specific measures or technique given like the resections are very extensive? How do you, mitigate the risks during the redo surgeries?
So usually redo surgeries are because of some untoward complications which we can't avoid. For example, in cases of flaps, if the flap has undergone necrosis because of less blood supply, then we have to just uh, consider upon a necrosectomy and re-flap surgeries. In cases of like abdomen, the intestinal anastomosis leaks. Now, all these are chances of leaks or the necrosis is because of, again, the change the homeostasis of your body, basically. For example, as far as now, if we are focused on, see, I'm not actually talking about the per se surgical skills techniques, but depending upon how we can prevent these by maintaining the post-operative care is by maintaining proper nutritional support to the patients and pre-operative nutritional assessment so that they will be ready for everything. So that's why if
So, I think we lost you in the last bit.
am I audible?
Yes, sir, you're audible now.
Yeah.
So moving forward to our next segment, which is mostly nutrition related, what are the typical food intake related complications that post-surgery cancer patient may face? And how do these affect the recovery and the overall well-being of a patient if we see it from a holistic picture?
Yeah, the majority we try to maintain the protein intake as well as the calorie intake after surgical resections, especially for first week. For first 2 to 3 days are very important because they are in catabolic state. That is, all the hormonal hormones are upregulated, like glucagon, cortisol, and all pro-inflammatory cytokine storm is there. So they are in a catabolic stage, and that's why the requirement of calories and proteins are very much high. Even gluconeogenesis in liver is upregulated, and a little bit insulin resistance happens, and that's why that's why glucose is not properly utilized. So all these to be taken care initially for first 3 to 4 days with the proper nutritional balances, caloric intake, protein intake. Now, once we try to give, because majority of these patients are either on some riles to feed or some kind of total parental nutritions. Now they also suffer constipations because of less fiber intake. So we have to increase and balance the fiber intake also in post-operative diet. So these are some of the things, that is the proteins, calories, to mitigate the catabolic state as well as to enhance the wound healings, and probiotics and the fiber intakes to to actually prevent the constipation and the related problems.
Thank you, sir, for recommending the dietary adjustments and interventions that can prevent these complications. Moving forward, how does the recovery process impact the efficacy and tolerance of the adjuvant chemotherapy? Like, what's the guidance that you offer to your patients to enhance their recovery in anticipation of the chemotherapy?
Yeah, see, the thing is, in case of chemotherapy, one thing see, in chemotherapy there are two set of complications. One which is actually visible complication. The visible complication, like means hair loss or skin changes, nail changes, and some invisible complications. That invisible complication in the sense the immunity is suppressed, blood count is suppressed because of the bone marrow suppression. Now, majority of these complications can be again prevented. Plus, there are few like nausea or acidities that again can be prevented by the medications. But majority of the complications which are visible as well as non-visible can be prevented by proper nutritional support. Now, the post-operative nutritional support and the nutritional support during chemotherapy, they are very different supplements basically. The supplements designed during chemotherapy should be different than the post-operative supplements, and they have for example, post-operative we need we need more focus on calories and proteins. During chemotherapy we need more focus on not only calories but even micronutrients, vitamins, to prevent many things. So that's why overall, during surgery, before surgery, and even after surgery, during chemotherapy, we need nutritional support to the patients in a very proper way.
Sure, sir. So, and what are the gastrointestinal issues that such patients frequently suffer from, and how do you evaluate them and address these complications, given the fact that you need to promote patient comfort and recovery at the same time?
Uh, Gastrointestinal complications of, you are saying, of surgery,
In general,
or
when patients undergo the for cancer surgeries, when they undergo these surgeries, so then during the post-operative care period, given the fact that they're having dietary issues, like you've mentioned, the metabolism and all those things in details. So, what are the gastrointestinal issues that they suffer from, and how do you, where does your role come into
no,
play?
no, especially for example, in cases of abdominal surgeries, for if we do a retroperitoneal dissections, that is, we handle the retroperitoneal nerve complexes, and these kind of surgeries reduces the peristaltic movement of this intestine, and
All
because of
right.
that there is a gastric paresis as well as the intestinal paresis, and that's why there are the quick bloating, as well as the because of less peristaltic activities, the full diet can be given very efficiently unless and until the bowel gets recovered. So we got a limitations for then oral nutritions in that cases, and we have to rely on total parental nutritions or semi-total parental nutritions along with that to fulfill those calories and protein intake. That is the only thing which actually can happen in especially abdominal or gynae surgeries for the gastrointestinal paresis. Rest of the things is, for example, in head neck, we have to give the riles tube feeding for a long time, for 2 or 3 weeks or 4 weeks. Now, in riles tube feeding, when we do these are the liquid diets mixed with all the supplements, then we suffer the less fiber intake, and that less fiber intake leads to again constipations and bloating. So we have to balance, even if the patient is on riles tube feeding, we have to balance not only the caloric and protein intakes and vitamins and all supplements, but even the fibers.
So, given the fact that when a patient undergoes a cancer treatment planning, and the doctors find they need to undergo a surgery, is there any dietary changes that they can be made before the surgery, given in
Yes.
patients, specific to the patient and their body type or anything of that sort?
Yes. Ideally, you should be surveyed for your nutritional status before surgery. Ideally, there are the nutrition departments in the hospitals, and we usually, for the major resections and major surgeries, especially after chemotherapy patients, we send it for the nutritional assessment. And beforehand only, we actually understand what are the deficits and lacunae, and we try to correct it at the before surgery itself, so that actually it enhances the recovery and it reduces this hospital stay and the complication rate.
Thank you, sir. So I do have a
Yeah.
few questions from our viewers. One of our viewers wants to know what are the risks that are involved in the redo surgery, and how do you approach managing the complications in patients that require repeated redo surgeries?
Now, so a redo surgery especially is because of the either because of the local recurrences or the recurrences of the cancers. Now, for example, there are few cancers which are very notorious to recur. For example, ovary. Now, ovary is known for repeated recurrences, and then but that is a one organ where we have to do a repeated surgeries. So, redo surgeries, see, any kind of surgical intervention hampers your nutrition for a long period. And again, you are once you are up and all right, and if you are going ahead with the second resection or redo surgery, again that trauma to the body is happening again. So that's why throughout your period, even if it is recurring, we are going ahead with the redo surgeries, your overall nutrition and immunity should be proper so that you can withstand all those, and we can give a hope of cure.
Thank you, sir. So, one last question before we wrap up this session. This is out of my personal curiosity. So, we have already discussed a lot about nutrition post-surgical care, but given for oral cancer cases, the resection, like the primary way of consuming food is kind of blocked. So, how does the management differ from oral cancer patients and other forms of cancer, like abdominal cancers?
Yes, see, oral cancer patients, oral cavity, that is, we resect and reconstruct. So for the long period of time, almost like 3 to 4 weeks, they are nil by mouth. So just they can drink just water or clear liquids, but rest of all the food material is to be given through rice tube. So it is rice tube feeding. Now that rice tube feeding has its own limitations basically, because we cannot give everything what we eat through rice tube. So there are limitations to give that feed, and that we have to design that feed as per the body weight requirement, the type of resection done, and all those that quantities, not only the macro, but even the micronutrients are mixed with your kitchen feeds and to be given to the rice tube. And not only that, and we are giving it as in liquid form, and that's why we need to give some supplements which gives a fibrous content also. So this actually can linger around for almost like a month or 2 months in cancer, oral cavity cancer patients. And once they are okay by healing wise, then we start the oral feed and we remove rice tube. So that's why it is very important to rely on basically to a few of the supplements with kitchen feed to nullify the deficit basically.
Thank you so much, sir. Sir, would you like to please give your concluding remarks?
Concluding remarks in the sense, see, right from the prevention to cure, prevention of cancer, again, see, not all cancers are preventable, but majority of cancers are preventable. Now, by changing your lifestyle you can prevent it. By maintaining proper immunity you can prevent it. So immunity and nutrition is important, so not only for prevention, but also once it happens, then even for the cure, early recovery, and reducing complications, we need our nutrition and immunity proper. So take care about your nutritional status and immunity by changing your lifestyle habits, food, and exercises. So everything is important for prevention and cure respective.
Yes, sir. Thank you so much, sir,
Yeah.
for your time and your amazing inputs for this topic today on empowering oncology through nutrition. We thank you for your time. Thank you so
Yeah.
much.
Thank you. Bye.